Hi, this video is the art of a head transplant restoration surgery on a client who has a class 4 or 5 hair loss pattern, threading from the front toward the back. And we will be trying to harvest around 5,000 grafts and filling from the front toward the back. See, these type of hair, miniaturized hair is still there, but it's very weak and it's on the way out. Now, since he has some hair, the client wants to restore the hair, and so that way less detectability, because if he wait to completely get something done, and then when he starts have hair transplant, some people might notice a little bit. But since he has quite a bit of hair, but all these are miniaturized hair, he's rather replace it and starting from the front all the way toward the back around 5,000 grafts. Front half 2,500 grafts to 3,000, and whatever left in the back we'll put in the back there. And I'm very excited about him because I know in a year time he will look fantastic. It will look completely different. It's very hard for him to, the way he leaves his hair all around bushy, but then this part is hard. It doesn't grow that much. And in restoration in hair transplant, it's not just the surgical skill of the surgeon and the exact science, which will dictate how dense your hair is, but you have to focus on the artistry behind it too, because the artistry will, especially when you recreate the hairline, it will allow you to have a very natural hairline that when you walk down the street, no one know you should have the hair transplant. And that's our goal, that once it's done, it will be as if Dr. Diep never been there. And so on average, from the mid eyebrow to the hairline for Asian and black is around 6.5 to 7. For Caucasian is around, from the mid eyebrow to the hairline is higher, so around 7.5 to 8.5 centimeter. Other ethnicity varies somewhere in between. Again, we use the average height, ethnic hairline height as a guide, but really when we build the hairline, we build the hairline according to each individual facial structure. For this client, it's roughly around 7 centimeter. And the more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. This patient is somewhere between, so he arched back quite a bit like that. So no hairline straight. And then we zigzag through. This line is an imaginary line because there's no real line. So we dance up and down that median line. And then, so we're going to put a lot of stripe. Once we get the shape down and doing the zigzag, we will transplant at 35-45 in the front. Increases when you go backward and change it when you go different direction. Then selection of hair grafts is important. We transplant rows and rows, single hair graft in the front, followed by root 2 hair, 3 hair, and 4 hair in the back for bulk and volume. So this is the art of hair transplant restoration surgery on a client with a class 4 or 5 hair loss pattern, threading from the front all the way toward the back. Very weak frontal forelock, and we'll be attempting around 5,000 grafts today. And stay tuned for a year later because I'm very excited for him. And he will look completely different. Thank you.